Medidenta. Suitable endodontics.
In this segment, we are going to talk about the low engagement instrumentation technique for curved canals, like upper premolars, for example. It is very important that you take a look in the two previous videos, the low engagement technique fundamentals and the low engagement technique for narrow and curved canals. There's a lot of preliminary information that is very important. For example, how to prepare the pulp chamber or how to determine the working length. Let's take a look.
The technique will be demonstrated with the Medidenta's M-File Gold instruments. These files are composed of a USA Fort Wayne's nickel titanium alloy, with a rhomboid triangular cross-section. The proprietary heat treatment performed leaves the instrument with extra flexibility, predominantly in the martensitic phase. The M-File Gold recommended rotation is at 300 revolutions per minute, and torque of 1.5 to 3 newtons per centimeter. The instruments must be sterilized before use, and are for single use only. M-File Gold instruments are offered in diameters from 15 to 60 in taper 04, and 15 to 50 in taper 06. The color of the M-File Gold rubber stop indicates the taper. The green is 04. The red is 06. We are going to use the same 3D printed endo block used for the curve and narrow canal in the previous video. In this segment, it will be demonstrated step-by-step instrumentation of curved canal using the mesiolingual canal. The mesiolingual canal is representing the majority of curved canals anatomy. It has a mild curve from mesial to distal, and equally a slight curve from buccal to lingual. After pre-flaring, use a stainless steel K-file to determine the working length. Place the instrument inside the canal and advance to the temporary working length. With the instrument in position, turn on the apex locator, connect the lip clip and file connector. Gently advance apically with oscillatory movements until the apex locator points to position 0. Remove the file connector and proceed with a smooth enlargement, with the file in position, using oscillatory movements. With the pulp chamber full of sodium hypochlorite irrigating solution, pour RC prime and start pre-flaring. Enlarge the cervical and medium thirds with an M-File Gold 2506 rotary file to the limit of the curvature. Use the brushing movement against the side walls. After enlargement, proceed with copious irrigation. After determining the working length, use the M-File Gold 2504 up to the working length limit. Do not use pecking movements. Do not exceed 10 seconds of instrumentation. After enlargement, proceed with copious irrigation and patency with the same K-file. The next instrument in the sequence is the same M-File Gold 2506, used before in the pre-flaring phase, but now it must be used up to the working length. Copious irrigation and patency with the K-file 15 should always be performed after using the rotary instrument. Optionally, you can finish the preparation with a 3504 instrument. This final enlargement results, according to studies, in a more efficient cleaning. Finalize your preparation with copious irrigation and patency. The low engagement technique described results in a space suitable for safe gutta percha master cone insertion until the working length. Thanks for joining us in this video. For more information, go to www.medidenta.com.
Medidenta. Suitable endodontics.